nature and scope of counseling. Let's see the introduction. We have already studied the unit titled Understanding Guidance, and it will help you to understand the concept of counseling better. In fact, counseling is considered the central and most important part of the whole guidance program in the school. All other activities and services of a school guidance program lead to and help in the counseling process. And it is through counseling that the individual is ultimately helped. Therefore, it's very essential to understand the concept of counseling clearly. The meaning of counseling in the professional sense differs very much from the popular understanding of the term. For the layman, it means a piece of advice, a suggestion, recommendation, or providing some information. But professionally, counseling is the scientific process of helping the individual to understand himself or herself better in relation to his or her environment so that he or she becomes self-dependent, self-directed, and self-sufficient and is able to lead a better and meaningful life. Counseling is aimed at helping the individual in solving problems that are already present, preventing the occurrence of problems in future, and also enhancing personal, social, emotional, educational, and vocational development. Thus, counseling has remedial, preventive, and developmental aspects. In this unit, we'll provide you with a clear understanding of the concept and meaning of counseling. Later on, we will discuss the principles and goals of counseling, theoretical orientations, techniques, and the process of counseling in detail. Then we will examine the qualities and characteristics of an effective counseling. Since group counseling is emerging as a separate field in recent time, we will also discuss it. We'll also discuss briefly the special areas in counseling as well as the importance of evaluation of counseling services. You should remember that the purpose of this unit is not merely creating awareness, but also you should be able to make practical applications. Meaning of counseling. Let's see various definitions of counseling. We have already stated that counseling is the most important part of the guidance program. We have also seen that the meaning of counseling in the professional sense differ from the popular understanding of the term. Now, let us examine the meaning of counseling more closely. For this purpose, we shall analyze the various definitions of counseling. It will help us clarify the concept. Rogers describes counseling as the process by which the structure of the self is relaxed in the safety of the client's relationship with the therapist and previously desired experiences are perceived and then integrated into an altered self. According to Halm and McKean, counseling is a one-to-one relationship between an individual troubled by problems with which he or she cannot cope alone and a professional worker whose training and experience to help others reach solutions to various types of personal difficulties. Smith defines it as counseling is a process in which the counselor assists the counseling to make interpretations of facts relating to a choice plan or adjustments which he needs to make. Pepisky and Pepisky define it as counseling as that interaction which occurs between two individuals called counselor and client, takes place in a professional setting and is initiated and maintained to facilitate changes in the behavior of a client. According to Steffel, counseling is a learning teaching process. Gustard stated that counseling is a learning oriented process carried in a simple one-to-one social environment in which the counselor, professionally competent in relevant psychological skills and knowledge, seeks to assess the client by methods appropriate to the latter's needs and within the context of the total personal program to learn how to put such understanding into effect in relation to more clearly perceived, realistically defined goals to the end that the client may become a happier and more productive member of society. From the several definitions, it can be seen that counseling involves a relationship. It involves a relationship between a professionally trained, competent counselor and an individual seeking help. This relationship is not casual, matter of fact, or businesslike. It's characterized by warmth, understanding, acceptance, and trust. Counseling and related fields. For a better understanding of counseling, it's necessary to study its relationship with other fields. Counseling and psychotherapy. Psychotherapy is the treatment of problems of an emotional nature by psychological means. The fields of counseling and psychotherapy are having a lot of similarities as well as differences. Rogers suggests that counseling and psychotherapy are exactly the same. However, it's not totally true. We can distinguish both on the basis of individuals receiving help, persons giving help, and severity of the problems covered. In psychotherapy, the person receiving help is generally a patient who is suffering from some kind of mental illness. But in counseling, the person receiving help is generally a normal person facing some difficulties of adjustment or developmental problems. Secondly, the person who is giving psychotherapy is called psychiatrist, who has a basic medical background, whereas the counselor need not have any medical background but has extensive training in the field of psychology. Moreover, in psychotherapy, the aim is to cure a certain ailment, but in counseling, the aim is to help in self understanding. It's more of a learning process. In spite of the distinctions mentioned above, it's very difficult to separate these two fields. There's more overlap than differences. In both, the aim is to assess the person to lead a more adjusted and satisfying life. In both counseling and psychotherapy, the relationship between the client and the therapist or counselor is of vital importance. Moreover, while handling emotional problem of a deep nature, counseling approaches psychotherapy very closely. Guidance and counseling. Guidance and counseling terms have been in use interchangeably. Laymen and sometimes even counselors use these terms as if they are synonyms, but it's not correct. Both counseling and guidance are mutually related processes, but not the same. Guidance is a more comprehensive process which includes counseling. Guidance services include many other services apart from counseling. We may say that counseling is the most specialized and most important service in the whole guidance program. Instruction and counseling. Another term closely related to counseling is instruction. There are some basic differences between instruction and counseling. Instruction is usually obligatory to be followed by the person who receives it, whereas in case of counseling, the counselee is not obliged to act according to anything said by the counselor. Actually, nothing is told to be done in counseling. The ultimate aim of instruction is the development of the individual, and the immediate aim is the learning of a subject or a skill. But this is not so in the case of counseling. Moreover, the instructional program is time bound and structured, but counseling, on the other hand, is not structured and no time limit is fixed. Advice and counseling. Counseling is sometimes confused with advice giving. It's necessary to dispel this confusion. Advice is sought with the conviction of being told what to do, and advice is given with the expectation that what is told will be done. The person seeking advice is not really responsible for the course of action and the consequence thereof. It's not always necessary for the individual to understand all factors related to his or her action. In the counseling, on the other hand, the very understanding of all related factors is the crucial matter. Moreover, in advice giving, the advisor is making decisions for the individual, whereas in counseling, decision making is wholly the responsibility of the counselee. Introduction to guidance, and therefore the counselor is fully responsible for his or her actions too. Advice giving may be an incident and will be over in a brief meeting, but counseling, as we have seen, is a process. Now, what are the principles of counseling? Counseling is based on a number of principles. Let's see them. Counseling is a process. That's number one. It's necessary for the counselor to understand that counseling is a process and a slow process. Failure to understand this will result in annoyance and disappointment. The second one, counseling is for all. Especially in the school situation, counseling is meant for all the school students and not only for those who are facing problems or other exceptional students. School situation counseling is more developmental and preventive than remedial in nature. The third one, counseling is based on certain fundamental assumptions. Every individual in this world is capable of taking responsibilities. Every individual has the right to choose his or her own path based on the principles of democracy. Number 4, counselor does not deprive the right of self choice but simply facilitates choice. The counselor should give due respect to the individual and accept him or her as he or she is. Number 5, counseling is not advice giving. Number 6, counseling is not thinking for the client but thinking with the client. Counseling is for enabling the client to do judicious thinking. Number 7, counseling is not problem solving. The counselor simply assists the person to find solution on his or her own. Number 8, counseling is not interviewing but conversing with the client in order to help him or her develop self-understanding. Number 9, the counselor should determine individual differences and provide for them. The counselor has to prepare the client to be open to criticism, including self-criticism. The counselor acts as a facilitator or a catalyst only and creates an atmosphere which is permissive and non-threatening through a warm and accepting relationship with the client. This helps the client to explore themselves and understand themselves better. Goals of counseling. Many consider counseling a panacea for all ills, which is not true. Individuals have wide-ranging and many a time unrealistic expectations regarding counseling. This in turn leads to disappointment. The reason for this state of affairs is lack of proper understanding as to what exactly are the goals of counseling. Some of the major goals of counseling generally accepted by the counselors are given below. Achievement of positive mental health. Individuals are said to have positive mental health when they are able to relate meaningfully with others and lead a fulfilling life. They are able to love and to be loved. One goal of counseling is to help the individual to attain this state. Second one, problem resolution. Another goal of counseling is to help individuals to come out of a difficult situation or problem. It must be remembered that individuals are only assisted and they themselves find solution for the problems. Number 3, counseling for decision making. Ability to make right and timely decisions is crucial for success in life. One major goal of counseling is to make individuals capable of making independent decisions. Counselor may assist the individual by providing necessary information or clarifying the counselee's goals, but the decision should be taken by the counselee. Number 4, improving personal effectiveness. An effective person is one who is able to control impulses, think in creative ways, and has the competence to recognize, define, and solve problems. It can be seen that these different goals are not exclusive. These are all interdependent and overlapping. Number 5, help change. For development, change is always necessary. Counseling helps individuals to make changes in their attitudes, perceptions, or personality. Number 6, behavior modification. Another aim of counseling is to help in modifying behavior. Removal of undesirable behavior or self-defecting behavior and learning desirable behavior is considered necessary for attaining effectiveness and good adjustment. The behaviorally oriented counselors are the chief proponents of this view. Major approaches to counseling. The practice of any profession is based on a system of beliefs and assumptions, generally called a theory. Counseling is no exception. In the case of counseling, though many elaborate theories have been proposed, no single theory explains all aspects of counseling. Therefore, the term approach is generally preferred because it's more comprehensive term. An approach provides a coherent definition for the counseling process, a clear statement of counseling goals, and a rationale for the selecting of particular counseling techniques. There are three major approaches to counseling: directive approach, non-directive approach, eclectic approach. The directive approach. As the name itself implies, this approach envisages a more active role for the counselor. The counselor employs varying degrees of direction to help the counselee to reach sound solutions. Moreover, through the specialized knowledge and experience in scientific diagnosis and interpretation of data, counselees are helped to reach earlier solutions for their problems. According to Frederick Thom, the proponent of this approach, the need for direction by the counselor is inversely proportional to the individual counselee's potentialities for self-regulation. The basic responsibility for reaching the solution is primarily with the counselor as the counseling proceeds. Counselees are encouraged more and more to take up increased responsibility for self-direction. This approach presupposes a more personalized relation with the counselee, where the counselor strives to identify psychologically with the counselee for a better understanding. Counseling steps. Directive counseling involves analysis. This involves collecting from various sources the data needed for an adequate understanding of the client. This includes administration of psychological tests. However, such testing and form filling should not come between the counselor and counselee, and its importance should be limited to the extent that it gives a better idea about the counselee. Number 2, synthesis. This refers to summarizing and organizing the data so obtained as to reveal the assets, liabilities, adjustments, and maladjustments of the counselee. This includes of the data obtained through psychological testing also. Number 3, diagnosis. This stage is concerned with formulating conclusions regarding the nature and the course of the problems exhibited by the student. Drawing conclusions from the results of psychological testing, administration of questionnaires are done here. Prognosis. This refers to predicting the future course of development of the counselee's problem in the light of conclusions as made earlier. Counseling. This is the most important and time-consuming step in the whole process. This is where the expertise of the counselor is needed most. It's a highly personalized teaching and learning process. It may be direct teaching through explicit explanations, assistance in searching for relevant aptitudes, and interest that illuminate the counselee's problems, and so on. Sometimes the counselor listens in a friendly and encouraging way. It may also involve practice sessions where, with the warm support of the counselor, the counselee acts out the way he or she should. Thus, he or she becomes his or her own teacher to the extent his or her capabilities and circumstances permit. Success thus achieved reinforces and retains those successful behaviors which in turn establish an adjusted way of life. Thus, counseling involves the following: assisting the student in self-appraisal, that is, identifying his or her interests, motives, and capabilities; helping him or her to plan a course of action which utilizes the capabilities and potentialities so identified; establishing an adaptive lifestyle. Two types of data are needed to help the counselees appraise themselves: self-perceived data and data from external appraisal. The counselees themselves are the best source of guidance and certain type of information. However, the counselor should also communicate the information obtained through analysis and diagnosis. However, the counselor should be cautious enough not to make the counselee think that both of them are in the same state of ignorance. Counselor does not enumerate in detail the steps of analysis and diagnosis, but the counselee is given an overall idea. Counselors should avoid a dogmatic position, but through their theoretical knowledge, experience, and judgment, assess the counselee. The counselor should not at any time appear indecisive because it can cause loss of confidence in the counselee. The counselor should maintain a varied and running discussion of the case data, taking clue from the counselee's changing facial and verbal expressions. Thus, the counselor cooperates with the counselee to reach a valid interpretation of the case and an effective program of adaptive behavior changes. Non-directive counseling. In this approach, the counselor provides an atmosphere in which the clients can fully explore their own thoughts and feelings freely without any fear or pressure. By making the counselees understand their potentialities, the counselor acts as a catalytic agent. Here, the source of data is the client, and the responsibility for change rests with the counselee rather than the counselor. The counselor should not be as passive as trying to keep out client's way, nor should be as active as to shift the focus from client to counselor. Central hypothesis. Carl Rogers, the chief proponent of the client centered approach, has formulated a central hypothesis as follows. Individuals have latent capacity, if not evident, to understand those aspects of him or herself and their life which are causing them dissatisfaction, anxiety, or pain, and the capacity and the tendency to reorganize themselves and their relationship to life in the direction of self actualization and maturity in such a way as to bring a greater degree of internal comfort. This capacity will be realized when the therapist can create a psychological climate characterized by genuine acceptance of the client as a person of unconditional worth, a continuing sensitive attempt to understanding the existing feelings and communications of the client as a person of unconditional worth, a continuing sensitive attempt to understand the existing feelings and communications of the client, and a continuing attempt to convey this empathetic understanding to the client. It is further hypothesized that in such an acceptant understanding and non-threatening atmosphere, the clients will reorganize themselves. The adjusted way of life as achieved in therapeutic relation with the counselor will be generalized to real life situations as a whole. Thus, the whole idea of the theory is that the clients are capable of correcting misperceptions or incongruencies between self and experience in the accepting environment of a counseling situation. If the counselor possesses some personal qualities like congruency, counselor being a genuine and integrated person, unconditional positive regard, non-evaluative attitude of the counselor, whereby client's thoughts, feelings, or behavior are accepted without judging them as good or bad, and empathy, counselor's ability to know the client's word and to convey this understanding. However, this theory underestimates the need for the counselor to be an expert in behavior dynamics, problem solving, techniques, or developmental process. Moreover, Rogers rejects the use of diagnosis testing and other such techniques, saying that they hinder the client's natural growth. Instead, Rogers stresses on listening, paraphrasing, and reflecting the client's comments rather than interpreting and direct questioning. Eclectic approach. Here, the counselor bases the counseling on concepts taken from various available viewpoints. Counselor incorporates those procedures and techniques which are the most effective in the case of that particular counselee without any prejudice or bias to any particular school of thought. According to Thorne, eclecticism is the most practicable and apt approach to counseling because no two people are able, and as such, no single theory of personality could explain the various behavioral patterns exhibited by individuals. So also each problem is unique in its content and intensity, and a technique or approach suitable in one case need not even be effective in the second case. So the summarization: different authors have defined counseling with differing emphasis on various aspects. However, most of them agree that counseling is a process and involves a relationship between professionally trained counselor and an individual in need of help. Psychotherapy, guidance, instruction, and advice giving are some topics closely related to counseling. Although these fields are closely related to counseling and there are some similarities in their functions, they are different from counseling. Counseling as a scientific technique is based on a set of principles and assumptions. Counseling assumes that all individuals are capable of taking their own decisions and also that they have a right to choose their own path. The counselor does not give them advice or solves problems for them, but only facilitates judicial thinking and decision making. Lack of proper understanding as to what exactly are the goals of counseling will lead to unrealistic expectations and resultant disappointment. The major goals of counseling are achievement of positive mental health, problem resolution, decision making, improving personal effectiveness, help change, and behavior modification. There are three main approaches: directive, non directive, and eclectic. Irrespective of the approach used, counseling generally passes through four stages: initial stage, middle stage, final stage, and termination.